Dengue fever, a mosquito-borne viral disease, has significantly impacted tropical and subtropical regions around the world. The disease is caused by the dengue virus, transmitted through bites of infected Aedes mosquitoes, primarily Aedes aegypti. Although records of dengue-like symptoms date back several centuries, the global recognition and documented epidemics of the disease surged during the mid-20th century due to urbanization and globalization. The spread of dengue fever is intricately linked to environmental and human factors. Urbanization has played a pivotal role in the proliferation of the disease. Rapid growth of cities, often coupled with inadequate housing and poor infrastructure, provides optimal breeding grounds for mosquitoes. Stagnant waters in urban slums and improperly managed waste create abundant habitats for mosquito larvae, facilitating the transmission of the virus. Globalization further exacerbates the spread of dengue by enabling the movement of both people and goods across borders. This mobility allows the dengue virus and its mosquito vectors to reach new geographic areas. As people travel, they can carry the virus to regions where local mosquito populations can become new vectors for the disease. The biological and ecological mechanics of dengue involve both the human hosts and the Aedes mosquitoes. When a mosquito bites a person infected with the dengue virus, it can carry the virus for about a week before becoming capable of infecting other humans. This cycle of transmission is particularly effective in densely populated areas, where frequent human-mosquito contact is inevitable. Moreover, the virus exists in 4 different serotypes, which complicates the immunity landscape. Infection with one serotype provides lifelong immunity to that specific type but not to others, potentially leading to severe forms on subsequent infections with different serotypes. Socio-economic and public health challenges also contribute to the widespread incidence of dengue. Many affected regions suffer from inadequate public health infrastructure, which hampers effective mosquito control and public education on prevention methods. Climate change further influences the spread of dengue by altering temperature and rainfall patterns, enhancing mosquito breeding conditions and extending their active seasons. Additionally, socioeconomic factors such as poverty and the lack of resources significantly hinder the ability of communities to control mosquito populations and implement effective public health interventions. Travel and mobility contribute to the spread of the virus to new areas, increasing the challenge of global dengue control. Dengue fever, with its significant presence in tropical and subtropical regions, poses extensive health, economic, and social challenges worldwide. According to the World Health Organization, there are approximately 390 million dengue infections annually, of which about 96 million manifest with varying degrees of severity. The disease can range from a mild flu-like illness to severe forms like dengue hemorrhagic fever and dengue shock syndrome, which can lead to severe bleeding, organ impairment, and even death if untreated. The impact of dengue fever is profound and multifaceted. In terms of health, severe dengue infections can overwhelm healthcare systems, especially during outbreaks when the number of severe cases spikes sharply. The case fatality rate in these instances can be as high as 20% without proper treatment. Economically, the cost of dengue fever includes not only direct healthcare expenses but also indirect costs such as lost productivity and decreased tourism, which can severely impact local economies. Socially, the fear and disruption caused by dengue can lead to significant community and school absenteeism, affecting daily life and community cohesion. Preventing dengue fever primarily involves controlling the mosquito vectors and reducing human exposure to mosquito bites. Efforts to control the mosquito population include source reduction techniques like the proper management and disposal of solid waste and the elimination of standing water, which serve as breeding grounds for mosquitoes. In addition, applying larvicides to water storage areas can effectively reduce the mosquito larva population. Personal protection measures are also vital. Using insect repellents that contain DEET, picaridin, or oil of lemon eucalyptus can significantly reduce the likelihood of mosquito bites. Wearing long-sleeved shirts, long pants, and hats helps minimize skin exposure. Installing mosquito nets and screens on windows and doors can provide physical barriers against mosquitoes, especially in residential areas. Community engagement plays a crucial role in dengue prevention. Educational programs can raise awareness about the importance of eliminating mosquito breeding sites and protecting against mosquito bites. Community-based efforts to clean up neighborhoods can dramatically reduce mosquito populations and thereby the incidence of dengue. Public health measures, including the implementation of robust surveillance systems, are essential to quickly detect and respond to dengue outbreaks. The introduction of the dengue vaccine, Dengvaxia, offers a preventive measure for those who have previously been infected with the dengue virus, though its use is recommended under specific conditions due to concerns about its effectiveness and safety in individuals not previously infected. Collective and continuous efforts involving government, local communities, and individuals are essential for effectively managing and mitigating the impacts of dengue fever. Such collaborative approaches are crucial to reducing the disease's burden and preventing its spread in endemic regions. Dengue remains a significant global health concern, particularly in tropical and subtropical regions where the mosquito vectors thrive. In 2023, a record number of dengue cases were reported in the Americas, with over 4.2 million cases, surpassing the figures from the previous peak in 2019. This dramatic rise is attributed to factors like urbanization, climate change, and disruptions caused by the COVID-19 pandemic, which have all facilitated the spread of the Aedes mosquito. Brazil reported the highest incidence, contributing significantly to the regional caseload, while countries like Peru and Mexico also saw high numbers of cases. The prevention of dengue fever involves a combination of personal protection measures, community engagement, and public health strategies. Effective vector control remains the cornerstone of dengue prevention. This includes the use of chemical insecticides, environmental management to eliminate mosquito breeding sites, and biological controls such as introducing larvicidal agents into water bodies. Individuals are advised to use EPA-approved mosquito repellents, wear protective clothing such as long-sleeved shirts and pants, and sleep under mosquito nets to avoid bites. Engaging communities in maintaining cleanliness and removing standing water can prevent mosquito breeding. Public health systems need to enhance surveillance and prepare for outbreaks by ensuring the availability of necessary medical supplies and diagnostic tools. The strategies for controlling the spread of dengue focus on reducing the mosquito population and limiting human exposure to mosquito bites, with an emphasis on community involvement and preparedness to manage and mitigate the impacts of outbreaks effectively.